Hi everybody, I'm Gianfranco Parati. I'm Professor of Cardiology at University of Milan. I'm the current president of the World Hypertension League. The World Hypertension League, as you may know, is a non-profit organization in direct link with WHO, and its main mission is to promote better hypertension control and obviously better cardiovascular protection to people living all over the world. It's an ambitious project, it's a great responsibility, but we have a big team, a great team of persons working in different countries aiming at this important target.
Hello, everyone. My name is Markus Schleich. I'm a professor of medicine, nephrologist, and hypertension specialist, and I'm privileged to be the president-elect of the World Hypertension League. I work closely with Professor Gianfranco Parati on all aspects of hypertension and hypertension management on a global scale. And we are fortunate, to have the opportunity today to have this chat about hypertension, elevated blood pressure, the risks that come with it, how we can manage and assess it. So we sincerely hope that you will enjoy, get some valid and valuable information out of this meeting. Thanks so much for having us today.
We need blood pressure to live. Blood pressure is generated by the heart, who is pushing the blood into the arteries. So we need to have a blood pressure. But sometimes blood pressure is higher than needed, and then it might be damaging the heart and the arterial system and might be responsible for a number of complications. That's why we need to know what is our blood pressure. In many previous campaigns, we're asking people in the world simply to know their numbers. And the first number to know is exactly what is your blood pressure. The heart is generating blood pressure, and you all know that our heart is contracting to push the blood into the arteries, and then is relaxing to be filled by the blood coming from the venous circulation. In our arterial system, when the heart is contracting, there is a peak of blood pressure, and this is systolic blood pressure, the value we are recording in the phase when the heart is contracting. But then we also have a second value, which is when the heart is relaxing, and the pressure that was stored in the arterial walls is given back to the blood, because these arteries are elastic in a way, and this maintains the flow, and this is the diastolic blood pressure. So we are recording every time we measure blood pressure these two values, which are represented to different moments of the cardiac cycle and to different moments also in the arterial circulation.
So, as Gianfranco just explained, what these two numbers we usually measure mean. One is the systolic, one is the diastolic blood pressure. And you may wonder, what do we consider normal? What is the blood pressure we would like most people to be roughly at? And to answer that question, I think, first of all, it's important that it's not necessarily a fixed number. It's a bit of a range of blood pressure. As you can understand, we need a certain level of blood pressure, obviously, to perfuse our organs to ensure that enough blood supply comes to our organs. And usually what we consider as an optimal blood pressure in somebody who's perfectly healthy, often, of course, young people, is below 120/70 millimeters of mercury. Millimeters of mercury is the unit we use to express the level of pressure in the system. And people, when we grow older, we tend to have higher blood pressure for various reasons. But overall, what we're trying to achieve in the vast majority of people is a blood pressure lower than 130 and lower than 80 millimeters of mercury for systolic and diastolic. These are perhaps the numbers to remember. And, the higher the blood pressure in general, obviously, the more likely there may be damage. The high blood pressure causes strain not only on your vascular system, but also on the organs that are being directly perfused from those arteries and the pressure, such as the heart, the kidneys, the eyes, and the vasculature in general.
When you measure your blood pressure, you might see different numbers every time you measure it. Don't worry, this is absolutely normal. Blood pressure is changing continuously because it's in a way representing the adaptation of our circulation in the context where we live. So we have to face environmental stimulation, emotion, whatever. So if you run, if you're talking to a person, your blood pressure might be higher, but it is not a disease. It's absolutely normal. And this variability is physiologic. Of course, if your changes are too wide, this might be a problem. And then this is a case where you have to discuss with your doctor what these changes might mean.
Another important consideration is that it's usually not really worthwhile just to look at a single reading at a given time. As you've heard already, blood pressure by nature can be fluctuating to some extent. So it's more about detecting patterns over a longer period of time and averaging those to see whether or not you're in general in the right range or above. And that would help your doctors then to decide whether or not, some treatment way may be warranted. The problem with continuously high blood pressure is that it can affect the organs that are directly perfused from those arteries. And usually we think about the heart, the kidneys, the brain, and the eyes, and the peripheral vasculature that can get some of that damage. And perhaps, Gianfranco could comment on the risks, particularly related to stroke, heart attacks, and kidney disease.
It's very important to understand what happens if blood pressure is too high. A high pressure implies more work for the heart, but also implies a damage on the walls of the arteries. There is a stress on the wall every time there is a wave of blood pressure coming, if this is elevated. So the heart, over the years, can undergo several types of problems. First of all, the pump itself might be damaged, and in the long run, it might become weaker. And this is leading to heart failure, where the heart is no longer able to push the blood into the circulation and to guarantee a perfusion of the organs. And that's a very dangerous complication. But you may also damage the arteries, the arterial walls, including the arteries who are bringing blood and oxygen to the heart itself, the coronary arteries. So also in this case, you might see a damage in these arteries, which are crucial to feed the heart. And then you might undergo ischemia or myocardial infarction, where the heart can have a damage to its own cells, and some of the pieces of the wall might die, which may be very risky for the patient. A similar phenomenon happens in the brain. The brain is essentially depending on circulation for its function. If you have a too high blood pressure, this is damaging the arteries, carrying the blood into the brain circulation, and you might have two types of problems. You have an ischemic stroke, where the plaques, the damage occurring on the arterial wall might lead to an occlusion of one of these vessels, so some part of the brain do not receive blood any longer. The other problem, which is related but different, is when a given blood vessel might break down due to a high pressure, and you might have a hemorrhagic stroke, which is also damaging very seriously the brain. Where you measure blood pressure is important. Blood pressure is not always the same. So when you go to see your doctor, to have a visit, to ask for advice, you might have some emotional reaction to the doctor's presence, and your blood pressure might be higher while you are in the doctor's office. This is what we call white coat hypertension. Even if a doctor can be wearing a green coat, don't worry, that's a usual term we are adopting, white coat hypertension, which is a measure of your reactivity to the doctor. And this is something that might be explained by emotional mechanisms. But you have to be aware that this is not completely innocent, because this might be a spy that you are reacting too much to stress, which might happen also in your life, and in the long run might damage your cardiovascular system. The other opposite situation is when you go to your doctor, you have a normal pressure because you feel relaxed being with your doctor, but then in your daily life, you have higher blood pressure value when you face, for example, job stress, emotional reaction, difficulties in your life, or even during sleep, when you have some respiratory problem, typically the apneas, the occlusion airways that are leading to some snoring first, and then if the occlusion is complete, the cessation of the flow of air for a few seconds, that's the apnea. In such a case, you might have higher pressure during the day or during the night, which is not seen while you are in your doctor's office. And this is why we call this masked hypertension. And this phenomenon is dangerous because it might be responsible for the same damage as when you have always an elevated blood pressure. That's why we are recommending to measure blood pressure not only in the doctor's office, but also outside, either at home, where you can measure it yourself, or using little devices that can keep recording your blood pressure for 24 hours during your daily life and during the night as well, by measuring blood pressure automatically. In such a case, you can quantify this phenomena and be aware what is really happening to you in your usual life.
So you've heard already that there's different ways of measuring blood pressure, and the most common way is still that we measure it in the office. We can do it at home, and we can use so-called ambulatory blood pressure monitoring. All of them are complementary and all of them are relevant. A key aspect, though, is that we try to standardize these measures. As Gianfranco already alluded to, a variation of blood pressure is quite normal. So if we can standardize the measures as good as possible, we get more reliable results. Now, most of you may perform home blood pressure monitoring. Important that you have a so-called validated device that organizations who are equipped and experts in ensuring that these devices measure accurately, that you've got one of those machines at home. The other important aspect is that you have a cuff that sits snugly around your upper arm. In other words, it needs to fit the circumference of your arm. And obviously, we may have bigger people, smaller people. So you understand that the size of the cuff is an important one. And most machines come with a number of different cuffs. Then it's also important that you give yourself a bit of rest prior to taking the readings, that you sit in a quiet place without talking, not doing anything else, and wait usually for 5 minutes before you take one of two readings. And if you do this 2 times in the morning, 2 times in the evening, usually for a period of around 7 days, that's what we recommend currently in Australia and in most countries in the world as a good means to get a better idea of your blood pressure across 1 week, and averaging those numbers gives us a reasonably good indication where your average blood pressure sits, and that is a good basis to decide whether or not you may need some treatment because the blood pressure may be too high. There's a bit of a common myth, and that is that high blood pressure will cause symptoms. In other words, if people say, look, I feel perfectly fine, that's unfortunately not a guarantee that your blood pressure is okay. We do know that a lot of people, sometimes with pretty high blood pressure levels, still feel relatively well, almost perfectly fine. And the problem with high blood pressure is that it can cause some symptoms, but they are not very specific. symptoms could be headaches, for example, blurred vision, feeling unwell in general. So, this may have a number of different reasons, and you have to be mindful that this could also be blood pressure. So there's no way around really measuring blood pressure to ensure that that is hopefully in the right range. So usually you will not feel that your blood pressure is up, and therefore we want you to know your numbers. We want your doctor to measure your blood pressure, and we encourage you to measure your blood pressure at home along the lines we just discussed. Gianfranco, anything from your side to add?
Well, what you said is very important, Marcus, because hypertension is recognized all over the world to be the most dangerous silent killer in the world. And that's exactly why, because it might be damaging without any symptom. So you do not realize that something is going on that might damage your cardiovascular system. And the only way to acknowledge this and to be able to counteract this dangerous situation is measuring blood pressure. Marcus was saying very importantly the need of measuring blood pressure also at home, so outside the doctor's office, so you can keep track of your blood pressure in different situations. But please be aware that you need to do this in an accurate manner. We are recommending now validated devices, automated devices, and unfortunately, I have to say, 82% of the devices on the market are not validated. So before buying something, please ask your doctor. Your doctor should know that there are specific websites where you can find a list of the validated devices, so you can be reassured that you're going to buy something which is accurate and can really help you. If your measurement is not accurate, you might come up with funny numbers, and this is not helping you to protect yourself. So please be aware that accuracy is a mandatory issue when you measure your blood pressure, and you have to do this repeatedly, because blood pressure is changing over time. So don't be worried if you see different numbers. Again, that's very important for you to understand, but you can relax if you're using a validated device, because you know that these values are really representing what is happening into your arterial system. Hypertension management in the past decades has improved a lot, and we have reduced the complication of hypertension dramatically. This is something that we are very happy with, but we have not done everything. Something still has to be improved. Hypertension, in spite of the improvement, is still remaining a dangerous situation, too often undetected and very rarely controlled well, mainly in low resource settings. So please be aware that you need to contribute to your health by measuring your blood pressure regularly and by taking care of the advice given to you by your doctor to change your lifestyle if there is something that can be improved, and importantly, to take your pills regularly. By treating hypertension efficiently and regularly, you can protect yourself, live a longer life, and live a healthier life.
So please don't assume just because you may feel perfectly fine that your blood pressure is okay. Would encourage you to know your numbers. Ask your doctor to measure your blood pressure. Measure it yourself at home with the appropriate devices. Try to measure it correctly and look at trends over a certain period of time, not necessarily at just individual readings. If you need to be treated, it's important that you stick with your treatment and work together with your doctor. And if you have any concerns, please raise it with them. We're a team working together to try to optimize your blood pressure, which ultimately will lead to a healthier and a longer life. So know your numbers, measure correctly, look at trends, don't wait for symptoms, and you should live happily ever after.
Marcus and I, we hope you found this discussion interesting. we are trying to share with you our daily experience, but we would like to continue. So we are inviting you to another discussion, which will be broadcasted soon. And in this different situation, we are going to focus on stroke risk, or how to prevent stroke, either by controlling blood pressure better and by identifying an arrhythmia, atrial fibrillation, which is another important reason for stroke. So please join us in a short time to go deeper into the knowledge of what can be damaging your health, and even better, to understand how you might protect yourself better.